My name is Andrew O'Neill, and I'm a Master of Public Health student at Oklahoma State University. I grew up in rural Arkansas and as a gay man and experienced a lack of culturally sensitive services. My interests in the fellowship were rooted in this background. We know this is a broader issue with gay and bisexual men living in rural communities facing immense health challenges. They might not have a healthcare provider that they trust, so they often delay accessing routine health services, which can lead to preventable health complications. Even if they are able to find a supportive healthcare provider in the city, they might not have the reliable transportation or the necessary insurance to see that provider. Additionally, the lack of a strong LGBT community around them can make them feel isolated and takes a toll on their psychological health as well. I chose to partner with Health Outreach Prevention Education, Inc., or HOPE for short, to address this health disparity in the rural communities surrounding Tulsa. My project's aim was to provide a way for these men to talk about their sexual health barriers that they experience and determine specific goals to safeguard their sexual health. Specifically, I wanted to provide HIV testing and help them establish individualized, feasible HIV risk reduction plans. Through my project, I was able to expand and enhance rural outreach at HOPE. I worked with HOPE staff to provide HIV testing in rural Oklahoma using the mobile testing van and reached men in over 20 counties in eastern Oklahoma. I worked with participants to identify a feasible HIV risk reduction plan, utilizing motivational interviewing techniques, and provided follow-up phone calls for ongoing support, which was a new approach. There's one man in particular that I want to tell you about that participated in my project, and I met him out in the van while we were conducting outreach. And during our testing session together, he talked about wanting to start PrEP, a medication to prevent HIV, but was worried he couldn't afford it because he didn't have insurance. I worked with him and got him connected to the Get Prepped program at Morton Comprehensive that offers PrEP for those who are uninsured. And based on his experience and other men in my project, I was able to create a safe, non-judgmental space for men in these rural communities to really talk through their resources and make their own decisions about their sexual health. This year was a very powerful one for me, working with a community that is close to my heart. I got the chance to work on an issue that I'm passionate about. It's a very niche interest, yet I had the space to pilot a program through the fellowship. The fellowship gave me an opportunity to partner with a community agency and really enact what equity and mutual respect look like in a community partnership. Based on my fellowship experience, I decided to pursue a PhD with a particular focus on community partnerships in public health. One thing that I will take with me into my further studies and future career is valuing the importance of these community partnerships. The depth of knowledge of the people that do this work day to day, community connectedness, and their expertise inspires me. I am grateful for the skill set, experience, and knowledge that the fellowship has given me that I can carry forward.